Hey everyone! So it's December now, which means Christmas is on the way, but it also means that it's cold season. So I'm sure you've all had the common cold a time or two, and if you're like me, I'm just getting over it. So I've already had it this year. I'm going to go ahead and apologize for my scruffy voice. But anyways, let's get started. According to the CDC, there are millions of cases every year of the common cold in the U.S. And it happens typically 2 to 3 times for most of adults, and it's even more frequent in children. So that's what I'm going to be informing you guys on today, the common cold. You may have all had it, but do you know what it is? And more importantly, do you know how to prevent it and how to treat it? I use data from the CDC, which is the Centers for Disease Control, and the Mayo Clinic for this speech. So let's get started by talking about what the common cold is and what causes it. So the Mayo Clinic says that the common cold is an infection of your nose and your throat, which is your upper respiratory tract. And a viral infection is caused by a virus. And many types of viruses can cause a cold, but most typically it's a rhinovirus. So a cold virus enters your body through your mouth, eyes, and your nose, and it's spread from infected people to others through the air and close personal contact. The first signs of a common cold are typically a sore throat and a runny nose, which is followed by coughing and sneezing. Other symptoms can include a low-grade fever, fatigue, and congestion. So symptoms typically last 7 to 10 days. So if your symptoms become more severe or last longer than a week and a few days, you should definitely see a doctor to make sure you haven't developed a sinus infection or ear infection or anything else more serious. So like I said before, the spreading of cold-causing viruses comes through close personal contact and through the air. The virus enters your system after you've been exposed to it, and then you touch your eyes, your nose, and your mouth. The best way to prevent the spread of the common cold whenever you're sick is to make sure that you're frequently washing your hands, especially after every time you sneeze or you cough, avoiding contact with others, and being sure to use tissues. And right after you use the tissues, you should discard them. That way nobody else touches them or touches where they were at. It's also important to disinfect frequently used items. Like if you're like me and you live in a dorm, if you go sit in the lobby, it's a really smart idea to bring Lysol spray or Clorox wipes so you can kind of disinfect your area to make sure you're not spreading it to other people or wipe down doorknobs and stuff like that. So when it comes to preventing and reducing your risk of being sick, of course avoid contact with people that are sick, use hand sanitizer and frequently wash your hands, and avoid touching your face with unwashed hands or your mouth or your nose or anything like that. So when it comes to treatment, there's no cure or vaccine for the common cold. So your best bet is over-the-counter medicine to treat your symptoms. And there's great ones like Mucinex and other things like that for like a sore throat too. You can use stuff like that in lozenges. So it's more about treating your symptoms, not actually the virus. You just have to let it run its course. Drinking fluids also helped. I didn't realize that. I learned that from the CDC. I looked on there, and drinking lots of fluids will help you reduce your symptoms and help you feel better. But it's also important to know when you should see a doctor. Like I said before, more severe symptoms or if they last longer, you should see a doctor. So if your temperature becomes greater, like if you have a fever of 101.3 or more, you should see a doctor. And also if you develop a severe sore throat or a headache or a sinus pain through your face or pressure, you should see a doctor. So to conclude, now that you kind of know what the common cold is, what causes it, how to prevent it, and how to treat it, just a refresher, it's an infection of your upper respiratory system. It's called the common cold, again, because it's common. It happens. There's not necessarily a way to prevent it 100% of the time, but you can definitely lower your chance of getting it if you follow these tips. Another important thing to remember, like I said, sorry if I'm overstating myself, but it's very important to know when you should see a doctor because you don't know what else you have going on. It's very easy if you have a lower immune system for you to develop into more serious things, like even pneumonia can come after. You can develop pneumonia after you have a common cold if you don't treat it properly. So just remember during cold season to wash your hands, be careful, stay away from sick people, and disinfect your things. I hope this was helpful, you guys. I hope you learned a little bit and it was informative. Thank you.